Introduction to Public Health STIs group. Different types of STIs. Bacterial STIs. Chlamydia. Main symptoms include abnormal discharge, pain, or trouble urinating, typically found in the penile, vaginal, anal, and throat areas, and in rare cases the eyes. Gonorrhea. Symptoms most often occur in the penile area. Abnormal discharge, pain, or trouble urinating may occur, typically found in the penile, vaginal, anal, throat, and eye area. Lymphogranuloma venereum, or LGV, typically comes with painless sore, swollen lymph nodes, and it is common not to notice these symptoms, typically found in the penile, vaginal, anal, genital area, and throat lymph nodes. Syphilis, it is common not to notice syphilis symptoms either, typically a painless sore or non-itchy rash, typically found in the penile, vaginal, anal, genital area, throat, and skin. Human papillomavirus, or HPV, common not to notice these symptoms either, it is typically just painless bumps on the skin, typically found in the penile, vaginal, anal, and genital areas, and in rare cases, throat and mouth areas. Hepatitis A, combination of nausea, loss of appetite, fever, stomach pain, jaundice, dark urine, or gray-colored stool. Hepatitis B and C, combination of nausea, loss of appetite, fever, stomach pain, and jaundice. Herpes simplex virus, typically comes with itching, burning, or tingling sensation, painful sores or blisters, found in the penile, vaginal, anal, genital, and mouth areas. Human immunodeficiency virus, flu-like symptoms, headache, muscle aches, and joint pain, and swollen glands may occur, and it makes it extremely hard on your immune system to fight off other infections. Parasitic STIs, such as trichomoniasis, include abnormal vaginal discharge, pain, or trouble when urinating, typically found in the penile and vaginal area. Scabies, a rash between fingers, on wrist, armpits, genitals, and thighs, and includes major itchiness, typically found on the skin. Mental health and STIs, according to an article, approximately 19 million new transmitted diseases occur each year in the United States, with almost half being between the ages of 15 and 24 years old. Contracting STI can come with depression, anxiety, fear, and anger. These emotions may lead to impaired cognitive function and memory, decreased impulse control, psychosocial impairment amongst peers, increased susceptibility to high-risk behaviors and potential infections, substance abuse, and an inhibition of clear perception. According to the I Want to Know online webpage, young people between the ages of 15 and 25 years old account for most of the new STI cases here in the United States. 1 in 4 new STI cases occur in teenagers. In 2006, an estimated 5,259 young people between the ages of 13 and 24 in 33 states reporting to the CDC were diagnosed with HIV or AIDS, representing about 14% of the persons diagnosed that year. Infection percentages include 70% for gonorrhea, 63% for chlamydia, 49% for HPV, 45% for genital herpes, 26% for HIV, and 20% for syphilis. Here we have a graph showing infections within race and gender. We also have a graph here showing infections within race and gender. Treatment for STIs. Most STIs are treatable, and pregnant women are typically put at the top of the list to prevent spreading the STI to their unborn children. If the STI has a cure, which most do, it is typically treated with an antibiotic. If there is not a cure, such as with HIV or herpes, they are treated with antiviral drugs. The focus of HIV treatment is HIV destroys your CD4 cells, deeply weakening the immune system. It is treated with antiviral medicine, stops HIV from spreading and destroying your cells. Lifestyle and STIs. STIs affect people of all racial, cultural, socioeconomic, and religious groups in the United States. It not only affects your health, but also your lifestyle. Although many people can go on with life without knowing they're affected by it, some individuals experience symptoms such as pain across their body depending on where they have been infected. Pain can occur during sexual intercourse, and some STDs can threaten your life. Having an STD can negatively affect your mental state and quality of life. Living with STD means coping with a changing condition, but fortunately there are many resources to provide support. Modes of transmission of STIs. They are spread through sexual contact with another person who is infected. Even those who do not show symptoms can still pass STIs to others by contact with their skin, genitals, mouth, rectum, or other bodily fluids. These include vaginal sex, anal sex, and even oral sex. They can also be spread through direct contact with a lesion or sore, close personal contact, exposure to blood that contains an infectious agent, contact with vaginal fluid or semen, and sharing of needles. STIs are not only spread through sexual intercourse or sexual activities, it can also be spread from pregnant mother to child and from pubic lice. STI testing and taboo. You can get tested for an STI at your doctor's office, a community health clinic, the health department, or Planned Parenthood. It is usually quick and painless. Tests are typically administered through blood or urine, but not always. Some can be done through swabs of the cheeks or the inside of the vaginal areas. Be prepared to have an honest discussion with your doctor about your sex life and your past partners. Be prepared to let any past partners you have recently had know that you are infected with an STI, even if it is embarrassing, so they can get tested. It may make you feel dirty or bad, but you are not. Be sure to have a support system, such as a therapist or friends, just someone you can lean on so you aren't spiraling down. Since 1991, sexually active high schoolers went from 30% to 38%, typically having sex with little to no protection. 60% of students in a survey reported having sex within a 12-month period, and most did it without the proper protection. There is a major double standard with STIs and sexual intercourse. Men are praised for being open about an active sex life, while women are typically shamed. Religion teaching abstinence cause higher rates of STIs due to the fact that most are going to have sex anyways, and teaching abstinence is not teaching safe sex, therefore nobody is educated. The prevention of STIs. Avoid being sexually active with someone who has a serious health problem, such as genital sores, discharge, rash, or other symptoms. Use latex condoms each time you have sexual intercourse with your partner. Keep in mind that condoms are not 100% effective for preventing disease or pregnancy. Avoid sharing towels and underclothing. Make sure to wash before and after intercourse. Get tested for any type of STD. Be sure to avoid sex until you are cleared by a doctor, and be sure to have your partner or partners tested and treated before resuming sexual intercourse. And here are the references.